Welcome to Education Series 2024 from the Colorado Coalition for the Homeless. This is our July session entitled Economics of Homelessness, Basic Income and Other Benefits. Thank you all so much for joining us tonight. My name is Alexis Whittam. I'm the Director of Communications for CCH, and we really appreciate you all taking time on this Thursday afternoon, evening to check this out. We'll go ahead, hand it to Andrew West, who's going to do our presentation, a little background on economics of homelessness.
Thank you, Alexis, so much for getting us started today. And as mentioned, my name is Andrew West. I am the policy associate here at the Colorado Coalition for the Homeless. And I'm just going to start us off with a bit of level setting and give a bit of an overview about what we're talking about here and about the programs that we're mentioning. So when we get to the panelists, they can really dive in. And I'm going to start with a bit of level setting. To talk about economics of homelessness, there are a lot of different things that we're talking about. When we speak about the cost of homelessness, there are really a few different things. We could talk about cost to systems. There's obviously an enormous human cost, which I think hopefully everyone joining us tonight is well aware of, starting from a place of compassion. But we're also talking about a lot of different programs, and there's obviously a cost to funding these programs. And I just want to go by beginning by highlighting that the cost of the status quo is also enormous, that homelessness itself is, of course, an affordable housing problem. This is something that we've touched on in a lot of past ed series in our Homelessness 101, which I definitely encourage you to check out. And there is a large cost to just doing things as we're doing. The Denver Post reported that the city of Denver spends more than $400,000 for a single year just on sweeps and other solutions that we know are not really solutions and are ineffective in actually solving homelessness. So I want to highlight that the housing first approach that we've been advocating for at CCH has been proven effective for decades in getting people housing. And that is an approach that provides housing that is non-conditional, doesn't require anyone to work or seek treatment first, in contrast to the treatment first approach that we're hearing from a lot of different places and pushing back against that housing first that we know is so effective. And I want to provide some data from the Social Impact Bond Initiative, the SIB program that was launched in 2016 in Denver that provided targeted interventions to people who are experiencing homelessness who are frequent users of emergency systems. And throughout this program, we actually found that it was very effective, one, in getting people housed. Participants were much more likely to spend time in housing, both in the short term and over the long term. We found that 1, 2, 3 years after the program, 77% were housed after 3 years from the initial start of the program. The program was also very cost effective, and we found that it was, again, both more effective and cheaper to house people than providing all these emergency services, like shelter stays, police interactions, jail stays, emergency detox, all of those different things that are very expensive. So I just wanted to start off with a bit of that level setting and one way that homelessness is expensive. And here's a quick quote from the Urban Institute, which conducted independent research on the SIB program. And they found that not only did the Denver SIB program, Social Impact Bond, achieve better outcomes for people, it proved to be a better use of taxpayer dollars than the status quo of the homelessness jail cycle. The costs borne by various public funders were substantially offset by reductions in costs associated with the negative outcomes avoided by participants in the supportive housing program. Based on the evidence from the Denver Social Impact Bond, scaling up supportive housing would require an increase in funding at multiple levels of government, but it would maximize the return on investment of public dollars and help end the homelessness jail cycle. So again, we know that we're going to have to, this is an issue that requires some spending. We've been massively underinvesting in people and housing for decades, but there are obviously more cost-effective ways to do this, and that's what we're going to be highlighting in today's session. Next slide, please. Another way that homelessness is expensive beyond cost of systems is for individuals. There's a saying that is very expensive to be poor, and that is certainly the case for homelessness. A 2016 report found that Colorado's 76 largest cities have 351 anti-homelessness ordinances on the books. That's obviously a little bit outdated, but it gives you a sense of the scope and how widespread the criminalization approach is, charging people fines and penalties for camping, sleeping, sitting, lying down, and other basic life activities that usually would not be a crime and that would be perfectly legal if they were housed. I'll also mention expensive short-term options, getting meals one by one. I think we all know how expensive it is to get a meal takeout, or even fast food can be much more expensive than a home cooked meal, which is obviously very difficult if you lack a permanent residence. A lack of private space, having space to your own can be, not having space to your own can be really expensive. Either you're paying for storage or you're having items lost or stolen, even confiscated on a regular basis and having those replaced. That's something we see a lot with identification documents, can be prohibitively expensive and are often lost if you don't have a place to steal them, to store them rather. Sorry. Transportation costs can also be very expensive if you don't have a really stable way to go about that. And obviously, people have to get to appointments and all the places they need to go, and that can be not the most sustainable sometimes. And not necessarily financial costs, but a time cost, that accessing services and going through all of these systems, trying to get everything that a person needs while experiencing homelessness, can be very time consuming and can take time away from other important things that one needs to do. Next slide, I'll give a bit of overview of some of the more common public benefits, just so we all are on the same page here. I'm sure a lot of you are familiar with these, but I'll just give a quick rundown. Colorado Works is Colorado's TANF program, which is the temporary assistance for needy families that's available to families with children in the home. And when people join the Colorado Works program, they can get help with the monthly cash payment, as well as assistance with schooling, training, jobs, and other things. This is funding that is available to states, and states have a bit of discretion in how they're able to use that. But in Colorado, that is the Colorado Works program. Social Security Disability Income, SSDI, is a tax-funded federal insurance program through the U.S. government that is managed by Social Security and provides monthly benefits to individuals with disabilities that restricts their ability to be employed and earn enough money to cover all their expenses. Social Security, we're talking about Social Security retirement benefit, and that is a monthly check that replaces parts of one's income when they retire or lower their hours as well. And that the age that you're able to claim, the amount of the benefit depends on the age that you retire at. SSI is Supplemental Security Income, and that is a means-tested program that provides cash payments for those who are 65 and older. The Medicare program, the federal health insurance program that provides health coverage to those 65 and older with limited income and resources. Medicaid in Colorado, this is known as Health First Colorado. It is a state and federal joint program that provides health insurance for adults and children with limited income as well. And that can vary the names by the state, but in Colorado, that's the Health First program. And then CHIP, Child Health Plan Plus, is a low-cost health insurance program for certain children and pregnant women who earn a bit too much to qualify for Health First, but not enough to afford their own private health insurance. And the last one, SNAP, very common. This used to be the food stamp program, but that's a federal government program that provides assistance in purchasing food to maintain nutrition and health. So that's a lot of different things, and we'll hear more about that later. But these benefits are really important. One thing that it's important because, wages are not keeping up with increasing housing costs, and studies show that roughly half of people experiencing homelessness are working. I think that's a common myth that we hear a lot of the time, that people experiencing homelessness should just get a job, but in reality, a lot of folks are working, although it is often for very low wages. There's not a ton of research on this. One study from 2015, it's a little bit out of date, but found that people experiencing sheltered homelessness, so people who are not unsheltered, have earned $8,169 annually and just under $7,000 annually for those who are unsheltered. So while a lot of people are working, their wages are not high enough to cover a lot of the expenses they need, especially housing. We know that housing costs have really skyrocketed, and wages are really just having a hard time keeping up. So these benefits are really important in helping people bridge that gap between what they earn and what they have in total cost just to afford all of the things that they need. And here's a visual that I think is helpful, showing just really how much wages lag behind housing costs. The federal minimum wage has been stagnant at $7.25. Obviously, very low there. Colorado's a bit better at about $14.50, and Denver is even a little bit higher at $18 an hour. Um, We've got some great research from the folks at the National Low Income Housing Coalition that they publish every year, showing the wage that is needed hourly to afford a 1-bedroom, 2-bedroom, 4-bedroom apartment. And we find that each year that wage goes up pretty significantly. Colorado is now the 8th least affordable state for housing, and that wage for a 1-bedroom is creeping up to almost $31 per hour for a 1-bedroom apartment. So you can see when you compare that to something like the Denver minimum wage, it's really not even close. And that's why we're going to highlight some benefits and basic income programs that can help people bridge that gap. I also want to mention the self-sufficiency standard, which is a really interesting metric. It is a measure that calculates how much income a family must earn to meet their basic needs and does take into account family composition, where they live. So this measurement is for a family with 1 adult, a preschooler, and a school-age child. And it finds that self-sufficiency wage in Denver is about $40.46 an hour. I think what the self-sufficiency standard aims to do is take a more comprehensive look. Since the official poverty measures were developed a while ago, methodologically, they're pretty out of date. And they want a better estimate of what all of those things include. And I'll note that self-sufficiency standard is pretty bare bones, that just meets basic needs with nothing extra. A little bit more background as we talk about benefits. One thing that we'll probably hear during our panelists, and that is brought up a lot in public discussion around benefits, is this cliff effect. And the cliff effect occurs when a pay raise at work triggers a loss of benefits that is disproportionate. So that small raise can push people off the cliff, so to say, when it comes to benefits. You can find that small increase then makes you ineligible for things like some of those benefits that we mentioned before, that someone has a small increase in their hourly wage and then they're no longer eligible for SNAP benefits. So an example is that say someone is earning $14 an hour, which yearly is about $24,400 after taxes. Additional benefits for housing, perhaps childcare, food assistance benefits, can bring them up to $53,000 a year. And this is for someone who has 2 children under the age of 8. A lot of these benefits are obviously more available to households with children as well. If that person were to get a raise to $20 an hour, the salary would then become almost $35,000 a year, but they would lose $18,000 in benefits. So you can see that a small increase in wages leads to a net decrease in resources. And a lot of the times these public benefits cover things like housing that you then have to cover on your own. So that's the cliff effect that we're talking about, and something that we definitely look to mitigate as we're implementing programs. Let's see. Did we miss a slide there, or is this? Okay, there we go. I'll also talk a little bit about the Medicaid unwind. And I'll note that we published a report on a lot of the pandemic changes that were implemented related to benefits, related to SNAP, Medicaid. And when we talk about the unwind, there was a continuous eligibility requirement that was suspended during COVID-19. So the process for redetermining eligibility was paused during COVID to make sure that people had access to health insurance. But since the end of the public health emergency, everyone who was required to have their eligibility redetermined for Medicaid. And we've seen a large number of folks who have been disenrolled from health insurance. And Colorado is unfortunately terminating members at some of the highest rates in the country. So Colorado has a 48% disenrollment rate. The highest is 56% and the lowest is 13%. So even in states where this is perhaps a bit more efficient, more effective, we're still seeing a lot of people kicked off. And a lot of the time, the disenrollment is not for any eligibility reasons. It's not that people are no longer eligible for the program. It's that there's been an administrative barrier or procedural a snag where they perhaps don't submit a document on time. Perhaps it's not reviewed on time. So it's these procedural things that are seeing large numbers of people disenrolled from health insurance. Okay, so we got a bit of overview on benefits, and obviously we'll return to that a bit later, but I want to provide some background on the Denver Basic Income Project. The Denver Basic Income Project, the mission is to serve unhoused people by examining the impact of direct cash contributions in an effort to encourage a healthier society centered around human thriving. The program was launched in 2022 with 820 participants, and it is a public-private partnership that is supported by public funders, including Department of Local Affairs, City County of Denver, as well as private philanthropy, private foundations, and individuals as well. The program launched initially in 2022 with 820 participants, and luckily they were able to get funding to secure an extension. The extension began in February 2024. And as of now, we've got funding slated to continue through September. I know Mark and the good folks at DBIP are working very diligently to make sure that this program continues and that we look towards having a more sustainable, publicly funded basic income project. And that was available to all previous participants. So that included everyone, and 670 people were re-enrolled for that 6-month extension. There are 3 groups that people were placed into, and they were randomly selected. So no one could choose which group they were assigned to. It was all a random process. The first group received a monthly payment of $1,000 for a total of $12,000 over the year. The second group got a lump sum up front of $6,500 and then 11 monthly installments of $500. So they received that same $12,000 amount. It was just divided up a little bit differently. And that third group sort of acts as a control. That's a group that received $50 a month for a total of $600 a month, $600 over the year, sorry. And all the groups were able to access a phone through the program as well as a debit card. And it's also worth noting that for the 6-month extension, groups A and B were combined. So both of those groups then received $1,000 a month going forward for that 6-month extension. And to be eligible for the program, folks had to be connected with a partner service provider. So at CCH, we did applications at the Stout Street Health Center. And a lot of the folks that we saw were already connected to us through a case manager. Maybe they were seeing us for healthcare appointments or something like that. Everyone was required to be experiencing homelessness at the time, which was defined by as long as you're not sleeping in a place that you are renting or owning. So that includes people who are maybe couch surfing, maybe sleeping in their car, as well as those who are experiencing unsheltered homelessness as well. And then if there were mental health or substance use needs, people were required to be actively getting some treatment for those as well, getting some, making sure that those were addressed in some way. And folks had to be 18 years or older to participate as well. A little bit of info on the demographic makeup. 67% of participants identify as people of color. About a quarter of those identify as Black, and another quarter identify as Latinx. There was also a 77.7% of participants identify as multiracial, and nearly 5% identify as American Indian or Alaska Native. And that was done intentionally to reflect the disproportionate effects of homelessness for people of color. And we want to make sure that these programs are targeted to those who really need them. And then we know that there are, unfortunately, discrepancies in who we see experiencing homelessness. 48.3% identify as woman, and 2.3% identify as non-binary, transgender, or gender non-conforming. A lot of folks also have children in the program, and about a quarter have a dependent under 18. Uh, Important to note that there was a research component as well, and I'm sure Mark will talk about this a bit more. There was a optional research component, and most of the participants did opt in to join the study. And this gave us a lot of great data on health, well-being, housing stability, financial well-being. So when we talk about the success, we have a lot of great indicators for that that were informed by that research component. There was a long form survey that people completed when they enrolled. After being selected, there was an enrollment process and they completed the surveys there. Halfway in, there was a 6-month survey, and then at the year long, there was another survey. People also had the opportunity to complete short form surveys twice each month, and they were able to get a small cash benefit for completing that as a thank you for their time. Next slide, please. Thank you. And we'll talk about some of the results here. Again, I know we'll dive a bit more into that when we get to the panel, but we found that people were much more likely to be housed as a result of participating in this program. The percentage of total participants who were in a house or apartment that they rent or own from the start of the program to the end of the year jumped significantly, really significantly across all groups. We find that group B had the largest jump. That was the lump sum group that received $6,500 upfront, but all groups were really effectively housed through this program. Similar finding is that participants overall spent much less percentage of their time in a shelter. So you'll see that T1 is 18% for group A, 26%, I can't see super well, for group B, and then 22% for group C. And all of those groups saw significant reductions in shelter time through the program. So a really effective intervention in both getting people housed, but also getting people into out of shelters into more stability. And this is also reflected in people's perceptions of housing as well. I thought this was important to include because people overall feel much more stable in their housing through the program. And that sense of security is very, very important as we talk about extending this program and thinking of ways that are cost effective that we can provide stability to people. There was also significant jumps in financial well-being across all 3 groups. As a result of providing basic cash income to folks, it turns out that does help with their overall financial well-being. And here's a graphic that shows one's probability of being unhoused throughout that first year of the program. So we see pretty steadily across all 3 groups. As the program went on, people were much less likely to be experiencing homelessness throughout that year. Small group differences between A, B, and C. Obviously, the 3 of those were randomized, but all 3 groups were much less likely to be unhoused. Next slide. As we talk about public benefits generally and this targeted basic income, it's important to note that the 2 can interact. So for the purpose of this program, there were some programs that the eligibility was impacted by receiving basic cash payment. So example, SNAP and SSI, there was some possibility for impacts. And then others were exempted. So we were able to get an exemption for the TANF program, the Colorado Works program, and Medicaid as well. So by receiving these DBIP cash payments, it's not going to affect your Medicaid payments. But I did want to highlight this because this is an important advocacy component, making sure that as we look to extend these programs and make them more sustainable, we don't want people to be hitting that cliff effect, right? We don't want basic income to prohibit someone from receiving benefits like housing assistance that they're already counting on and that are really important. So we want to make sure that these programs work in tandem and operate as smoothly as possible by figuring that out. A couple other things related to basic income is a couple tax credits. I don't know if they're different from the Denver Basic Income Project, but they do provide they provide cash into the hands of working families who really need them. So a couple of these that were worked on in the 2024 legislative session. Special shout out to our partners at the Colorado Fiscal Institute who did a lot of work on this. But House Bill 241311 is the Family Affordability Tax Credit, which creates a refundable tax credit for families with children making $95,000 or less. And it also extends this credit to kids under 16. So this is built off the child tax credit, which has been enormously successful in lifting families and children out of poverty. So we were really glad to see that expanded. There's also 1312, which is the care worker credit, which creates a tax credit up to $1,200 for personal care aides, home health workers, child care providers who are a really important part of the economy, but unfortunately are underpaid in a lot of their professions. So that's a sector that we know is really important, and we want to create a boost for them and make sure that people are incentivized to continue doing that work. Last one, House Bill 241134, is around the state earned income tax credit. So that's the EITC there, which has been, again, very effective tool in lifting families out of poverty. And that expands the state credit to a larger match of the federal credit. There's the largest in the 2024 tax year, and then that sort of tapers off into the future. But really glad to see that match expanded for the EITC. So those are a couple other tax credit forms of public benefits, basic income that I wanted to highlight as well. And a couple things that work. Again, I know we'll hear more from our panelists about solutions, but making sure that benefits are really accessible, that people know how to access this, and when there are changes in these programs, that they are communicated timely and in a really easy to understand way. That means language access for folks who have different language needs, and making sure, again, talking about that broader eligibility, expanding programs and making sure that the programs work in cohesion with one another so people aren't facing that cliff effect, making sure that benefits are unrestricted, that people have access to cash in the way that they see fit, that we trust people to spend the money in the way and in ways that they know best. They know what's best for them. Again, having tapering benefit amounts. So instead of having that payment drop off when you reach a certain income threshold, having that taper off a bit can be more effective. And again, in the interest of making benefits work together, having combined application processes and automatic renewal. So those are all things that we want to be thinking of as we consider public benefits. And I think with that, I can pass it back. Thank you, everyone.
All right, thanks so much, Andrew. You did a great job contextualizing this really huge issue of economics and homelessness from a personal level and a structural level. And now we can move into a conversation around some solutions. So I'm really excited to introduce our brilliant panelists for tonight. We have Mark Donovan, the founder and executive director of Denver Basic Income Project. So that data that Andrew shared, Mark is really behind this project and those really incredible results. Allison Friedman Phillips is our second panelist, and she is the Director of Programs, Policy, and Advocacy at Women's Foundation of Colorado and a great longtime partner. And then finally, Luz Macias. She's a bilingual enrollment specialist at the Colorado Coalition for the Homeless. Thank you all so much for joining us. And I know we're working on some back-end challenges, trying to get Luz on the line here. So we'll start with Mark and Allison. So now that you've seen this data presentation from Andrew, is there anything that surprised you or anything that you think is missing in terms of the big picture of the economics of homelessness?
Thanks, Aubrey, and thanks, Andrew, for that presentation. Over 49% of the community that we're serving reports having some type of disability. There's a really strong intersection with that community. So I think that's a part of this story. And in terms of surprises, we were just really surprised at how well Group C did, only getting $50. And I think that was an indication that it's more than just about money. The money is really important, but also is approaching people and saying, we trust you, we believe in you, we see you, and having those connections to partners like the Coalition and all of our 19 amazing partners that were have these trust-based relationships. And also we provided everybody with a phone and a year's worth of service, and having that ability to connect with us and with you and with potential employers or housing opportunities is really vital. So I think all of those things are part of this. And then I guess the only other maybe piece of the big picture is that people don't believe that we have the ability to afford to do a basic income. And I always reply, how do we afford what we're doing right now? We kind of view basic income as preventative medicine for the economy. And when you treat something up front, it costs a tiny fraction of what it costs to not do that. And so I'd start right there. Pass it over to Allison.
Oh my gosh, excuse me. Thanks, Mark, and thank you all so much for having me. It's really great to be here. And I saw the reactions coming up as Mark was speaking and sharing about what he just did. And I completely agree. And I think to add on to that, I mean, I think Andrew's presentation was a really comprehensive and thoughtful overview of the topic. And I think, and it kind of came up in a few of the slides around just like, how do we change the narrative around deservedness? And we have this like really incredible solution that exists here with basic income or guaranteed income, cash assistance, all the different synonyms you might use for it. But we're hearing, and I know, we'll get into this later in the conversation, like we're hearing pushback from people of like, well, why aren't these people working? Like, what did they do to deserve this? Like, what are they going to spend their money on? All of these things that like, I don't think people ask about me as an individual walking through the world when I'm, working and doing things. Like, why do we have to ask about other people who might be experiencing homelessness, or who are people with disabilities who might not be able to work? I mean, all of those pieces. So I think talking about how we can change the narrative, how we can change the way that we all collectively on this call talk about this, so we can hopefully like ripple effect out to the larger community to have this, better understanding and better language that we can use to describe this, and hopefully make some bigger change.
Thank you both. Mark, so this is an opportunity for you to add anything that we might have missed in terms of the Denver Basic Income Project. And then I also want to ask, in terms of the momentum that this is creating, how do you think that this pilot might lead to bigger changes, a broader or more permanent basic income program?
Well, we're the first and largest in the country to explore the impact of providing a guaranteed income to people who've experienced homelessness. And so nobody's done this work before. So it's incredibly powerful and important. And the initial data is so exciting, but we still have so much to learn. So we want to continue running this longitudinally as long as possible, and continue understanding the nuances of this, of the different groups, the different cash methods, and understanding the pathways to housing and the type of housing that people are finding, and the quality of the housing, the sustainability of it. And we want to tell these stories so people can understand what's happening. There's a lot of biases against giving people money unconditionally, and it's one of the foundational pieces of this, to really say to people, we trust you, we believe you. Nobody thought this was real when we first said we were going to do it, but then when that first payment came, people were like, wow, you really do trust me. And that makes all the difference. And most of our programs with the social safety net are not built from a place of trust. And when you start there, it's incredibly powerful. And I think that's why we're seeing such strong outcomes, even from people only receiving $50. We have people saying, I'm alive today because of this. I'm clean and sober because of this. People are saying like $50 was enough to be able to pay somebody to sleep on their couch, and then I was able to get employed. The stories are endless, and it's really exciting to see the initial progress we've made.
So you both have mentioned kind of the narrative around basic income and around homelessness and people living in poverty in general. So let's dig in there a little bit. As we've seen the prominence of programs like this grow, particularly with the rise of artificial intelligence as well, We've seen some states pass laws that preempt or ban basic income. Some others have tried and failed. But can you talk a little bit more about the current climate around basic income and what we can do to overcome those negative attitudes? And Allison, why don't we start with you?
Well, yes, unfortunately, there are, I think, between like 10 and 15 states that either at the state or local level are trying to pass policies that would ban the ability for governments to provide guaranteed income. And we're seeing it in mostly red states. That in some cases might not even be providing guaranteed income in their state, but they are, trying to preempt that, or in red states with more cities or counties that are providing guaranteed income programs. And it's mainly being led by a conservative national organization that is, I mean, there's actually there's a really good article that I can try to find to put in the chat that people can read about the organization itself and some of their motivations. But I think some of the things that we've been seeing, and Mark, I know you're a part of a lot of these national conversations, also definitely want to hear, what you're hearing and thinking is that there should be a work requirement for people to receive these sorts of funds. And of course, a key, as Mark was saying earlier, a key part of all these programs is that there aren't requirements that the funds are able to be used at the discretion of the individual. And as Mark is saying, and all of these different programs, that is really a successful way to provide these funds. And so that being said, the good news is there is a national group called the Economic Security Project and the Income Movement that are working together to try to address in certain states where they are able to stop these sorts of bills from becoming law. And so my understanding is at this point, only one state, I want to say South Dakota, has passed a law that bans guaranteed income programs. And yeah, it's definitely an unfortunate trend that we're seeing. I mean, I feel like it's also kind of like, okay, we're doing something right. Like if they're working this hard in like 15, 20, 25 states to try to stop this work, we're on to something. So for, I think, a lot of people, it sort of emboldens them, but unfortunately, of course, it then takes resources from, organizations like the Women's Foundation who are working on systems change around cash assistance and guaranteed income to have to think about, okay, if a bill like this is introduced in the Colorado General Assembly next legislative session, do we need to use our lobbying resources to stop it when we could be working on a more proactive bill? So in some ways, it's certainly impacting the movement, but now that we're more aware of what's happening throughout the country, it's preparing us to hopefully stop anything that happens in Colorado. So I know I didn't get to the narrative change piece, but I did want to just give a little bit of background on some of the anti-work that's happening. And I'll drop a couple articles in the chat that folks can read more about that too.
You mentioned AI, and we are heading into a new type of economy that we don't even know what it's going to look like, but we know that there's going to be mass job displacement. And there are many people that are not able to work for very legitimate reasons. And I think that we need to decouple the value of a human being from our traditional definitions of productive work and paid work. And that we need to explain that when you provide a guaranteed income that's sufficient to cover the basic needs, we end up in a better place as a society. And that we should do that, not just for the benefit of the individuals that we're serving, but for the benefit of all of us. I think if we can focus on our common hopes as a society and see that this is a way to get there, a majority of people in this country do support this. It's not a political issue. It's not a partisan issue. And so I think that we need to move faster into this space as these changes are happening, and I think they're coming faster than anybody even realizes, so we can't do it soon enough.
I really appreciate those insights. Thank you. Allison, you're in a unique position as a foundation representative. So what kind of role do foundations play in supporting and advocating for progressive economic programs? And specifically, what is the Women Foundation of Colorado doing to convene and support this work?
Sure. So I'll answer the last question first. So for folks who aren't familiar with the Women's Foundation of Colorado, we're a statewide community foundation focused on advancing gender, racial, and economic equity. So we operate as a typical community foundation. We offer different philanthropic opportunities for folks. We also have two sort of key grant making strategies. One that's called WINCOME, and that is a multi-year grant making strategy that provides funds to organizations who can use those funds to provide cash assistance to their participants. And then the other part of that strategy provides policy and advocacy organizations with funds to engage in systems change work to get more resources to families and individuals through policy and advocacy. And actually, coincidentally, or maybe not, that grant making opportunity is open right now, and I can put a link in the chat so people can learn more about it if they're interested. If you work for an organization that might be eligible, the deadline's August 28th, so you've got time to learn more about it and look into it. And as an organization, we also, our endowment size isn't huge compared to other foundations in the state and the country. So we really believe that we can make an impact through our grant making, but that by engaging in policy and advocacy, we can impact all 2.85 million women in Colorado. And we've seen that providing cash assistance and guaranteed income is a really incredible opportunity to advance economic equity for women and all Coloradans, but in particular for women, since most breadwinners in the state are women. That brings us to the policy and advocacy piece that foundations can do. So we really believe that using our organizational resources and every part of our 501c3 tax limit can be used towards policy and advocacy that we can, safely under IRS guidelines use. So we take positions on legislation. We have a contract lobbyist. I'm also a registered lobbyist, and so is my colleague. And so we really try to get behind policies like many of the tax credits that Andrew was talking about in his presentation, and look at different rules, in particular individuals receiving cash assistance, to try to allow for the cliff effect not to happen. So those are just two, examples of where we've tried to engage in systems change, and we really do encourage our foundation colleagues and folks in the nonprofit sector to also engage in policy and advocacy, whether it's by, your participants in programs sharing their stories, or joining coalitions for your staff, or even having a lobbyist. I'm always happy to talk more about how you can do that in the nonprofit sector, and really hope that I know many of you on this webinar probably do that already, but if you don't, hope you'll join us in this work.
That's a great call to action. I know sometimes there's hesitancy among individuals or among nonprofits to engage in advocacy, but that's something that we can all do in some form or fashion. So I echo that call to action. So in terms of what went through the legislative process during this last legislative session, can you speak a little bit more to the specific policies and the environment around progressive economic policies at the Capitol?
Well, I think this last legislative session was a real win for women and their families. And that is in large part due to the tax credits that passed that Andrew, talked about in his presentation. The expansion of the child tax credit called the Family Affordability Tax Credit, that combined with other tax credits that people are eligible for, in Colorado is going to cut poverty in half next year, or child poverty in half in Colorado next year, which is pretty remarkable. And I think demonstrates what's possible when we can get behind like big systems change. There are a number of organizations, including Gary Community Ventures and the Children's Campaign, Colorado Fiscal Institute, and Bell Policy Center really led that coalition. And I hate listing organizations because I probably missed a key one. So there are a lot of people out there who worked really hard on that policy. And that I think is a really great example of what we can do to really just put more money in the pockets of Colorado families. That being said, Colorado has such a challenging fiscal situation with TABOR, the Taxpayer Bill of Rights, which really, holds back our state legislature from being able to raise taxes to provide funds for programs like the Denver Basic Income Project or other, pilots around the states that are happening. So there's also some really harmful ballot measures that one is already on the ballot. There's another that might also be on the ballot that would further restrict what we have at the state level to support, any sort of I think values aligned social program that I imagine many of us on the call are supportive of. So when I think about sort of the environment that we're in Colorado, those things sort of scare me. They're very daunting for us to be able to make big policy change. So I would encourage people to really look closely at the ballot measures that you'll have the opportunity to vote on this year at the state level and at the local level as well. In Denver, I know there are a couple of really important ones too. I'm sure we're all thinking this, it is a challenging time in our country with everything that's going on. But I would just really encourage you to look beyond the candidates that you'll have the opportunity to vote for this year and look at the ballot measures. The Women's Foundation will be releasing a ballot guide, Colorado Coalition for the Homeless and others will as well, that will help people better understand that. And I kind of veered off from what you asked originally, Aubrey, but I do think there is opportunity, in Colorado to make big change, but we're going to have to address some of these big ballot measure questions before we can do that into the future.
No, that was perfect. Thank you. And I'm so excited that Luz Macias is able to join us. She is a bilingual enrollment specialist at Stout Street Health Center with the Coalition for the Homeless. Welcome, Luz. I wonder if we can start with you telling us a little bit about your work. We've been talking a lot about these really high-level policies. So let's kind of look at what is happening on the ground with your day-to-day.
So basically, can you hear me? Okay. So basically, what I do is we actually meet with each and every patient that goes into our clinic, whether they're patients or not, we see them. And then we try to get as much documentation we can from them, an ID, social. If they don't have it, we're still able to submit their application. And then we'll send it into the Denver Liaison line. And it takes about 2 to 4 weeks for it to process. I think that one of the obstacles that we have is more of the people that have mental health issues, because we have a lot of patients there, others that say that they don't have time to just apply for it. Those are the main obstacles that we do have, but otherwise it's very simple. They work with us a lot. We work through the Denver Liaison line with Denver Health, so they help us, and if we have any questions regarding any application, we can call them. We have it's called the Denver Liaison line. It's our hookup line, so we're actually able to verify if they're having any issues on whatever documentation they need. And if they have, they say they need an award letter or anything like that, we work with our case managers there to actually help us, get that application done and help the patients there.
Thanks, Luz. So if I'm a client coming into Stout Street Health Center, this is my first time experiencing homelessness, and I'm trying to learn the ropes of public benefits and all of these systems that I'm trying to navigate. Can you kind of walk me through what that whole process looks like?
So with us, since we just do Medicaid, then I'll just help them with the Medicaid part. And then when they do ask like for food stamps or anything like that, then I'll reach out to one of our case managers and we'll set up an appointment for them to see them to help them with the rest of the benefits. Now, randomly, if we do have a patient that is very savvy on, going to Denver Human Resources or any other Jeffco or anything like that, then we'll give them that resource so that it'll help them go to them directly and it might process a little quicker because they'll just go directly to the human resource department.
That's helpful context. Thanks.
Mhm.
Can you also talk a little bit about the challenges and opportunities you're seeing right now around Medicaid enrollment and disenrollment and some of the eligibility issues?
Yeah, so basically right now we have we work with the report where we're getting all people that again we're on the ones that lost Medicaid. So we're trying to reach out. Our team is growing, so we have a team of 4 now. So for the first year, we've been there for over 2 years. So the first year I was basically alone because we didn't have any staff. And then the second year we hired 2 more, and then we just hired a new girl. So right now I'm training a new person. So we're gonna start doing outreach and going to the different locations that we have to help them out as well. So that's one obstacle that we're, overcoming. Another thing that I would like, if we can, is like try to get like a Medicare specialist to be on site because we have a lot of patients that have Medicare or that need to enroll in Medicare. And it's hard for them to go to Social Security or anything like that. So maybe if we have somebody there to help them full time, that would help us. So we can, work out with the medical savings plan, with the long-term care, all that stuff, because we have Recoup there as well. So now we're gonna be able to outreach and go to the different sites. And so that's helping, but another obstacle we do have also is room wise. So basically, HIPAA. So we don't want everybody to know their, information. So we're trying to get additional rooms to where we're able to actually pull them into an office and be more private. And that way we have, the more staff we get, the more room we'll have to help everybody.
I think you bring up a really important point about treating everyone with dignity and privacy and respect. So thanks
Yes.
for highlighting that.
Mhm.
So a question to all 3 of our panelists here. Some of the folks online today probably work in the sector. Some folks are probably community members who just want to learn more and assist neighbors and even impact some policies. So what would each of you recommend community members do to impact change, whatever that might look like?
I feel like outreach is one of the big things that I like that we do. So I think that's one of the things that I like, that we can actually help others and then spread the word out to everybody else that needs assistance. Because even though there's been people that have been homeless for quite a while, they still don't know that we have these additional benefits that they may qualify for. So word of mouth is something that also helps a lot.
Mark, why don't we jump to you?
Sure. I would say just remain hopeful and believe that we can do better and act today. Like everybody has their own skill set and ability to influence others and enact change. And it's so easy to get discouraged and to think that there's no possibility of things getting drastically better. And I think if you start from a place of just really believing that we can do this, we can do so much better, and just ask yourself, what can I do today that's going to impact somebody, even if it's just some kindness to somebody that you meet on the street. It makes a difference, and it's contagious, and it spreads quickly.
And that's really how DBIP started, right? Mark, can you talk a little bit about the very beginnings of the program?
Sure, it was 2020, COVID was hitting, and I was seeing people losing their sources of income and stability. And literally, like within 3 days from idea, I was giving out cash to people. I'm an entrepreneur. I've been fortunate with some investments. I made some money and have more than I need to live a really great life. And so I just started to act on that day in June. And from there, each step I took led me to some additional learnings, and I discovered all of the history of guaranteed income that told me this was a vastly underutilized incredibly powerful intervention that we're not incorporating into these spaces. And so, yeah, everybody has their ability to do that in their own way. And I just encourage people to do it.
Allison, let's jump to you.
I love being on the call with Mark because he's so positive. I feel like I'm the the other side of that coin. But I totally agree. There's so much we all can do as individuals. And I really like it's really good to hear that, Mark, and be reminded of having hope and being inspired. I also am excited to share that the Women's Foundation, along with some other organizations, including the Denver Basic Income Project, are starting a statewide coalition called Cash for Coloradans. And the goal of this statewide coalition is to bring together the different movements or programs that are happening in Colorado, whether it's Denver Basic Income Project, the Boulder pilot that's happening that's similar to DBIP, the Denver GI Coalition, which is trying to really continue to move from pilot to policy to make sure that the Denver Basic Income Project is funded through the City and County of Denver funds, the tax credit work that's going on. There's a couple other things. So it's really exciting how many different individuals and organizations throughout our state are really interested in cash assistance and guaranteed income and basic income. And we are starting this coalition to try to bring everyone together, work on narrative change, figure out what statewide policy or ballot measure opportunity maybe we'll have into the future, where we can really make this a widespread opportunity for our state. I can drop the link in the chat for folks if you want to join. And also I would just, encourage you to make sure you're really thoughtful about how you're voting in this next election for ballot measures. And there's an opportunity with the Denver GI Coalition as well to join and do like immediate advocacy this summer and fall to City Council and the mayor to try to make sure that we can get this city level funding. And I might be able to find the link to join that too in my email if I look for a second.
I always come away from these feeling so inspired and always appreciate some of those action steps too. I'm now going to turn to the Q&A. We've got a couple of questions and comments. We still have a few minutes together tonight, so please feel free to drop those questions in the Q&A and continue to connect with your fellow participants in the chat. One question from Jimmy is, are you thinking about making other payment categories related to Denver Basic Income Project, like maybe $100 a week and a larger sum at the end? Mark, can you talk a little bit about how you came to those three payment categories and if you would do the same thing again?
I think that if I were to do it again, I would go with a smaller group and a longer initial scope. So 2 to 3 years, even 3 years minimum. Is what I would do differently. And yes, we should definitely test different approaches to this. Our strategy right now is to run longitudinally, keep going as long as we can with the existing cohort to show what happens when you sustain a guaranteed income. We know what happens when you take away benefits. We all know about the benefits cliff, but what happens if you sustain this? We need to learn this. We also want to show that this is replicable and scalable. And so we're building a playbook, and we want to encourage other cities like Colorado Springs or Grand Junction, or we want to help other places set up similar projects that can show that this is possible everywhere and that show that it's scalable. There's a piece of legislation being brought at the federal level by Congresswoman Watson Coleman called the Guaranteed Income Pilot Project Act, that's seeking $459 million per year for 5 years for a 30,000 person federal level pilot. And they're looking to our data to help justify this and to try to sell this. And so there's lots of opportunities to do this work in other places and have those local communities have proximity to it so that they can understand it better and so that we can build the grassroots support to take it to policy. It's an uphill battle, but there is a very real pathway to policy, but we're only going to get there if everybody does their part and really gets involved.
Absolutely. Jimmy also left a comment saying that low-income housing is the biggest challenge in Colorado and is the housing category with the greatest need. Jimmy, you're exactly right. And at the coalition, and I think I'm in good company here, we are always advocating for housing resources and other resources proportionate to the need. There has been an unfortunate trend of resources going more towards middle income earners where there isn't as much demonstrated need. So this is a huge point of advocacy, and I'm glad you raised that. We also have a question from Anna Robinson. They say, I work with returning citizens and finding that the narrative work is even harder for that population versus families or folks experiencing homelessness. Do you have any thoughts on advocacy for more stigmatized populations or some of those intersections that make it even more complicated? And that can go to anyone who'd like to answer it.
I'm happy to share. We presented to the City Council Safety Committee yesterday, and Nick Pacheco, who's been working on this project almost from the start, was there. He spent over 20 years in prison. He's only been out now for 4 years, but he's been working with us for over 2 years. I think just showing these stories of success, these pathways of people that we create spaces and opportunities and trust and bring people to the table to have decision-making power. I think that's the way we can show that that we can push back against those negative narratives. And I'll just call out Just Income, a project in Florida that's specifically providing guaranteed income to returning citizens. And there's also a project in Washington, D.C. as well. And so I think by running projects and elevating this community and showing that guaranteed income can help reduce recidivism and also give hope to those individuals and opportunity to thrive is one way to do that.
Thanks for sharing. Well, we're winding up our time now, so I want to give each panelist an opportunity to leave us with any parting thoughts or anything that I didn't ask that I should have. Luz, why don't you kick us off?
I'm thinking right now.
If someone else wants to jump in first, that's also fine.
I'm happy to start us off. I just think it's important. I was talking about individual action, which I think is inspiring. I just watched the movie on Mother Cabrini the other day, and I mean, that story and the story of Clara Brown, I mean, these can really lead to major change and huge impact. But I do think we also have to continue to acknowledge and tell everybody that we talk to that this is a systems problem. This is a failure of our systems to have equal opportunity and systems that work for everybody. We do not have an economy that works for everybody. And so we need to move away from blaming individuals and have really serious discussions about the systematic injustice, racism, and just failure of systems to serve the needs of our people. And I think if we continue to do that and explore projects and interventions that are showing success and get behind them and scale them, social impact bond that you talked about, Andrew, I still don't understand why we're not scaling that. It worked and at the rate that we should, which is, we need to build affordable housing as fast as possible. And so we have a lot of the answers. We just have yet to get the political will to enact them at this pace and at the scale that's needed. And that's where all the grassroots organizing that we're doing and the Women's Foundation and the coalition's doing is so important. So I applaud everybody's work and then say, let's keep going.
I feel like I don't have much to add to what Mark just shared. I completely agree that it is about the systems. It is something that we can fix. Like, somehow these systems got us into these situations. Like, it might be hard, but we can back them out. And so helping, joining the Colorado Cross Disability Coalition, Denver GI Coalition, joining Cash for Coloradans. I think, to Mark's point, like when you're talking to other folks about this sort of work, talking about the stories, talking about how it's helped people, how trust allows for people to make their own decisions. I think hopefully we can start to build that like larger coalition that we need, and make sure we're also, I think another big part of this is if you are connected to elected officials at any level, sharing the success of these programs without strings attached to them, I think it is a really important next step as well.
And I feel like a lot of, also I agree with both of you. A lot of it also is communication is key. So like if we're able to reach out to every department and have like a POC, it helps us as well. Because even though I just do Medicaid, I do help patients with everything else that they need, so if they need housing, I try to refer them to wherever they have to go. I also work for the Catholic Charities, so I use some of the resources they give me as well to help the people at the coalition. So just helping each other also will help our patients, be successful as well.
Yeah, this is a community effort at every level. Well, thank you all so much. I'm going to turn it back to Alexis, who can close us out.
Thank you, Aubrey. Thank you to all of our amazing panelists. That was such a wonderful, robust conversation, and really nice to be able to take the time to really dig in. We often reference these economic statistics when we're doing our Homelessness 101 or in other sessions, but to be able to spend the time to dig in and, really have those facts lined up of how effective it is to provide income and to do these legislative efforts. It's really great. And it's nice to have a session where we're talking about solutions that work, because sometimes I know it's really hard working in this sector. So thank you all so much for taking the time. I know this isn't how everyone spends a Thursday night. So thank you to Mark and Allison and Luz, Aubrey for moderating wonderfully as always, Andrew for that great presentation, and my colleagues Gabriella and Shannon for helping this all happen. And of course, our fearless leader, Kathy Alderman, and all the staff at the coalition. Please join us next month. We do this the third Thursday of most months. So next month in August, we do have another session on Black Coloradans, health and homelessness. So we've been doing a few of these sessions where we're talking about specific populations who are overrepresented in homelessness. You can find on our YouTube page past sessions. We did one on Native American folks, one on Latinx folks, and then this one we're doing on Black Coloradans. So please join us next month. You can sign up. It's on our website. It'll be in that follow-up email that you're going to get tomorrow with the recording, and with the slideshow, you'll be able to also sign up for that as well. So please join us next month. And of course, as always, thanks to everyone who joined tonight. We really appreciate it. We're always so impressed by the number of people who show up and spend time with us doing this. Thank you again, and we'll see you next month.